life in 3 dimensions got me bent and got me twisted. I know I done said a lot, but I should probably stop pretending. I don't really hold the key and I can't really push a button. I just step up to the mic and try my very best to bust it, but I ran out of breath. It's tight in my chest, my feet just might fail. I can't stand the pressure.
All right, what's going on, everyone? Welcome back to Racially Speaking. This is my name is David Phipps, your regular host, and I'm excited to be back with you guys. Today, I'm joined by a new friend. We just been getting acquainted with each other a little bit more before I just hit record. But I'm joined by Amanda Navarro. Navarro, right? Navarro.
Yep.
Okay.
Navarro.
Navarro. Like I said, we're brand new friends. We've been emailing back and forth via her agency. Actually, I feel like a big deal, much bigger deal than I really am, guys. But Amanda, your people reached out. Angela, can shout out to Angela, reached out, put us in contact with each other, and I'm excited about this conversation we're about to have. Amanda, I know very little about you. Usually I have people on here that I've gone at least a few years back with, but I'm excited because like you said, I think we're kindred souls. We have a lot of the same beliefs when it comes to justice and specifically racial justice, and so we bring to this conversation what I think is something we're very much aligned on, and I'm excited to get to know you a little bit. So Amanda, could you introduce yourself a little bit, both to me and our listeners? What brings you on the show today?
Yeah, sure. Thank you. Well, first of all, thank you, David. I'm super excited to get to meet you and get to talk with you today on, I think, just some really urgent and important topics.
Yeah.
And you know what? I'm really confident this is not going to be our last conversation.
All
So
right.
I'm
Yeah.
excited.
Excited to hear you say
Um,
that.
yeah. So Amanda Navarro, third generation Mexican American. I was born and raised in El Paso, Texas, which is a border city.
Yeah.
I very blessed, abundant childhood growing up along the Texas-Mexico border. And I learned quickly when I got to college that I really had a very privileged life in being raised completely sheltered
Hmm.
from racism and discrimination. And I just feel very blessed to say that I had a strong, large community around me. Um, and that was not the case once I got to college.
Okay.
Everything changed after that.
Where'd you go to
Uh,
college?
I went to Vassar College in
Okay.
upstate New York
Yeah.
in Poughkeepsie. And, one of the more striking things was when I got there, and it's a liberal arts, super progressive, like right, I fit in and just felt at home. But what I started to see out in the world was, and we'll get into this, is being termed a minority. I never, growing up, had ever heard that term
Okay.
until I got out in the world.
Wow.
And
Okay.
so just this idea of like, oh, wow, okay, I am already considered and labeled less
Hmm.
um, than other people. And so that started my deeper racial consciousness awareness, just really understanding it. I'm someone that likes to just continue to ask. I'm very analytical, so I like to ask like why is this happening? Why is this not happening? So just learning and uncovering more and just keep asking with the whys. And the deeper I got into it, um, the way that I was really starting to understand and through lived experience see that communities, Latinx communities, Black communities, Indigenous communities, the way that they are set up is not random. It's because of policies and systems that were set up on our
Hmm.
behalf. And these are systems that were set up right from the very beginning of this grand American project in our country.
Hmm.
So I knew early on that how I grew up in a loving community where everybody mattered, and in seeing the stark difference of that absence of that in so many communities and the ways that people were treated just allowed me to really focus what I would say my calling on influencing those that are in power, policies and systems to improve people's lives. And that
Wow.
is all I care about.
Wow. That's fantastic. So so are you saying that, because my first question was, what originally led you to start speaking out about stuff like racial injustice? So would you, and I'm assuming you've done some, reflection on your past since then, but would you say it was experiencing just simply coming to college and being labeled a minority that got you thinking for the first time that, oh, this is something and I need to be speaking up about these things now?
That was one. And
Actually, I mean,
again, just
what led you from Texas to Vassar?
um,
Like, what in the world?
well, yeah, I had an angel on my side. There was a young woman who went to Vassar. She was my senior counselor at a summer camp that I did in high school. And she said, I think you gotta leave Texas for a bit. There's bigger things for you. Why don't you apply to this school? And I did, out of complete blind faith, and I did it. And it was the best decision I ever
Wow.
made. And she knew exactly where I wanted to be. And that opened up my eyes to so many things. But I would say this: my early memories of not just my family, my community, my neighborhood, but going out with my father, who was a local city advocate and city official, doing a lot of work around the Census Bureau later on in his years. I got to really see the differences in neighborhoods across El Paso. And one of the most difficult and humbling experience was when I worked at a rural health clinic about 30
Mm,
miles outside of El Paso city limits. And I would go every day. This was like the summer before my junior year in high school.
okay.
And at that time, this town had no running water, had no paved roads, maybe I believe one stoplight, um, and um, and no running water. So
Mm,
literally the level of impoverished conditions that I saw in this town are things that most people would think are in another country, right? That they don't happen here,
right.
but they do happen here. And
Right.
they happen within our borders. And when I really saw that, I also got to see so much of understanding that health is not created in hospitals or in doctors' offices.
Mm,
Health is created in communities and supporting communities well before they get to the doctor or the hospital. And in a town like this, where the closest hospital was 30 miles away,
wow.
right? There is a my understanding and my journey was really to understand what can we do that is preventative, that keeps people from having to fall into the ER or in places where treatment's too late, right? There's prevention that could have happened in the very first place. So that's what Convergence Partnership was actually founded on, that truth that health is not created just in doctors' offices, it's created in communities. So
Wow.
we look at health in a holistic way.
Okay, yeah, talk a
And
little bit about Convergence Group, and the work you do with that organization. Is your title
executive director.
executive director? So does that mean you helped start it, or did you come into that role?
I came into this role,
Okay.
however, so Convergence is a national funder collaborative. So it came together 18 years ago, which I
Okay.
still can't believe. 18 years ago, a group of funders came together at the time when childhood obesity was front and center in our national forums and policy discussions. And they realized, there's got to be a different solution. There's got to be different ways. And they really started with listening to communities. And there was the idea of like, we've got to focus on those upstream issues around policy and systems and not continue to just focus on programs that are working at the individual level. We've got to work at the systemic level to make real impact for, hundreds, thousands of people. And so when Convergence came together, I had just come into working as staff on the partnership a year and 2 years into its start.
Okay.
So it's 18 years old. I've been a part of it 17 of its 18 years.
Yeah, close enough to
And
the
so
beginning.
yeah, yeah, exactly. And I've had different roles and responsibilities, and honored enough to be able to take the role of executive director since 2021.
Okay. Wow, what a
2020.
time to take over a role like that.
Oh yeah,
Wow. Okay.
yes.
You hit on so many things right there. The organization sounds fantastic. I mean, let's jump into a little bit of healthcare. So what I gathered from at least the website and most of the literature on the website, you've since told me that you guys do other stuff even outside healthcare, but focusing in on healthcare. I love what you said, that a common misconception is that, oh, healthcare is just hospitals, doctors' offices and stuff, but that health is created in community. That is, I feel like, such a powerful thing to say, and what I would say is like a realization that if more people made, things would be a lot better and a much better place. Okay, as we come at this next part, I think we can all agree, listeners included, that we all want good healthcare. We all want to be healthy. Obviously, everyone across the board has different views of how to get there, and maybe even what healthy actually is. You brought up something like childhood obesity, and then I think about that being, not that I'm any kind of expert or anything, but that being a reality and a problem, and has been a bigger problem at certain times, as you're saying. And then I think I'm gonna throw something big at you right off the bat. And then fast forward to just like earlier this month with the current administration wanting to cut off SNAP. And so I've heard like a lot of pushback kind of in this conversation of, it's ridiculous that anyone would be made to believe that anyone is going hungry in America. No, we have a childhood obesity problem. We're the wealthiest country in the world, like all this kind of stuff. Not to play devil's advocate, because that's not what I'm doing, but to put both that contrast out there, what would you have to say to help us flesh out some common misunderstandings of what reality is as far as healthcare in our country, with those two opposite ends of the spectrum? With, there's childhood obesity and a health crisis. There's people going hungry. Like, how do those things coexist? Do they coexist?
Mm-hmm, mm-hmm. They do, and they absolutely inform each other. And as much as we're seeing so much being dismantled in a critical safety net like our healthcare system, there was also in the past incredible strides that have been made, the most recent being the Affordable Care Act. Now, we're in a very different place right now as we're discussing that and having to fight for that huge gain of allowing people to have the kind of coverage and support needed to be able to get the health care that they need. Now, again, that's one sliver. ACA also had a measure and provisions in there as it related to preventative health. So again, that's where the understanding that it's not just at the doctor's office, but everything that happens outside your community, right? So I would see people come in from the community, and they might be presented with a whole number of symptoms and issues or conditions, but the reality was that again, people were they didn't have living wage jobs. They were so isolated, transportation wise, to get to a hospital
Yeah.
30 miles away, even a doctor's office 30 miles away, to think about food access. There are food swamps. There are communities that all you see are fast food neighborhoods
Yeah.
that just have fast food restaurants. There's also some that have, all of the kinds of grocery stores and farmers markets that you could think of. So when we think about, and healthcare is important, and we all know that our country is sicker than it should be,
Mm.
and our healthcare system is overburdened, and it doesn't work for the majority of us in this country. So it's really, again, thinking about, let's not place all of the focus on that kind of treatment end, but what can happen all the way before we even walk into the doctor's office to make sure that we can live healthy lives
Yeah.
and have well-being. And for communities of color, the conditions that are shaping health, like what I'm saying, housing,
Yeah.
wages, environmental safety, all of that is influenced by racism, policy choices, and who has power and who lacks power.
Mm.
So for Convergence, in 18 years, our collective thinking has evolved, and it's had to, right? So as changing times, we have got to be smarter, better, know what's happening. So we started with the idea of social determinants of health, all those things that I just named, and that zip code determines your health outcomes.
Okay.
There's extensive evidence on this, so I won't go into that. But our most recent work, I would say over the last, 5 years or so, in part was informed by Dr. Daniel Dawes. He is a healthcare and public health scholar, expert researcher. He wrote in 2020 a book called The Political Determinants of Health, which I strongly recommend.
Okay.
He helped us reframe and think about social determinants of health as political determinants of health. And what I mean by that is resources like grocery stores, like access to transit, to transportation, good housing, all those essential services and resources don't just appear in neighborhoods
Mm.
randomly, not
Yeah.
just by accident, right? There were intentional policy and political decisions that were made on the distribution of opportunities and resources.
Yeah.
And those are not equal. And that's what we've been fighting for all these years. So at Convergence, we took this reframe to inform our work, to focus on growing that political, economic, and narrative power, which I'll talk about in a minute.
Yeah.
And the idea of power is one that in the public health realm and even healthcare is known as a contributing factor to health. It used to be called, agency, community, individual engagement,
Mm.
participation, voting. Those are all
Yeah.
ways that people have power to hold government accountable, but to also help to inform decisions that are being made on behalf of our lives.
Yeah.
And so many people do not have the resources to allow them to exercise that power collectively to really move us to a nation where we truly are healthy.
Yeah. That's good. Amazing summary. What do you, as the expert, and this is your livelihood, what does your day to day look like? Because you've done all this research, or people have done all this research, and you've identified all these things, this reality that, I love what you said, the zip code determines your health, to paint with broad strokes, and so many things fall under that umbrella. What do you then do? Like, what are you doing to change this other than just telling people or having this realization? Like, are you at meeting like town halls? Are you talking to legislators? All the above? Like, what are you doing day to day to actually move the needle?
Yeah. So part of Convergence in my journey, my personal journey, was really realizing that there were people that had the power of the purse, that there were people that
Mm.
had resources um, that should and could be unleashed to really be able to make transformative social change in this country. My work has really been focused on influencing philanthropy to begin to realize that there is a different way that we have to start to operate so that we can unleash these resources. There is no reason why we should be hoarding these resources, right?
Mm.
Foundations have sort of this baseline that 5% of their endowments go out to grant making. It should be so much more, but
Mm.
we need to be thinking differently about how philanthropy supports these kind of movements and work. So, that being said, the work of Convergence is understanding that Black, Brown, Indigenous communities were structurally positioned for worse health outcomes, not because of individual choice, but because of systemic deprivation and discriminatory narratives. So let me just talk about the narrative piece, because that's really what we've been focusing on these past couple of years.
Yeah.
So what I mean by narratives is they're the themes and ideas that permeate through a collection of stories, right? And these themes and ideas begin to shape our worldview, our attitudes, our beliefs. So when you keep hearing a story over and over and over again, right? So we can keep thinking about, envision what you would think, what is being said as far as a damaging narrative around who benefits from SNAP, right? Or Medicaid.
Yeah.
But we have to also understand that these narratives is what is informing people's decision and the policy and political process. So let me give you an example of some narratives that we're countering and trying to amplify positive narratives. This country, for as long as when it was built, we have this narrative of individual responsibility. So everybody pulling yourself up by your bootstrap, right?
Yeah.
And the counter narrative to that is actually we have a shared fate. We are our brothers and our sisters keepers. And so we must be working collectively together to help each other and take care of each other.
Oh, people
And
don't like to hear
so
that though.
people don't like to hear
Yeah.
that.
Keep
Exactly.
going. Yeah.
Um, yeah. Then we have this narrative around scarcity.
Hmm.
We don't have enough. We have got to get rid of this narrative that this country is poor and not wealthy. It is absolutely has enough resources, right? In this narrative of abundant resources to be able to deal with the problems that we have.
Yeah.
And then I'm going to be specific around this SNAP piece, Black and brown people, the narrative that they're fleecing SNAP programs
Yeah.
versus looking at our economic system, our health system, our food system. They're not set up to benefit people equally.
Hmm.
So when narratives like this divide us, so as Convergence, I would say, when those come up, someone has to disrupt them. And so that's the charge that Convergence Partnership took up,
Okay.
to bring evidence, to bring lived experience and a new story about what's possible. So those stories are not told by me. They are told by the frontline community leaders that we are supporting and we're funding across the country. And so we actually have on our website 2 seasons of podcasts that were produced and led and voiced by Black and brown leaders in communities doing the work that are on the ground. It is not coming
Mm.
from me.
All right.
So that's how we're starting that work around narrative change.
That's fantastic. I love. I'm an English major and professor at the local university too. So I love narrative and story and all that.
Yeah.
That's a little bit more my wheelhouse as well. I love that approach to activism. Um, where do I want to start? So, do you find yourself like, I mean, who are you telling this stuff to? Or you're saying you're not necessarily the one always telling the stories to, but when you're addressing something as misunderstood as SNAP. So I'm no expert in SNAP. I follow it as it is affecting, um, as it's affecting and it being taken away is affecting marginalized communities disproportionately, which I'll ask you about again in a second. But how do you communicate this issue in a way that you've seen it lead to change? Because
Yeah.
I'm not gonna lie, I'm not in the spaces you're in, and I find it hard to even get people on board with the notion that it's a problem and that it's not just this big political thing of today or of of the moment that's just being used to polarize everyone.
Yep.
so I'd wonder, like, how do you get people to actually believe that, um, hey, it's not just black and brown people, in your words, fleecing SNAP resources with the reality. I wonder if this is even true. I also read that actually SNAP, more white people benefit from SNAP than black and brown people. So, I mean, I hear that, and that I hear all kinds of things when I hear that, because I'm like, okay, so it's not, there you go. There's the evidence. It's not just black and brown people fleecing the resources. Oh, but then to somebody that wants to keep being combative can then hear that and be like, oh, look, you got, so black and brown people are making up this problem that um, something is being taken away from them because it actually is helping white people more. So I don't know. I think you're following what I'm saying, but how do you wade through all of that to get people to understand, hey, this is the reality. It's got to change. And do you find yourself being more proactive, or do you have to do some retroactive stuff? Like, do you have to tear down to build up, or do you just have to like keep your feet moving and do better moving forward? That was a
Yeah.
lot, I know.
Yeah. It is, and it is a lot. I mean, I'll say this. My In my personal journey, when I've reflected on, I was born and raised Catholic. So, while I don't practice anymore, I do consider myself a spiritual person.
Hmm.
And, it's hard for me, what I carry with me in those early years and in being part of the Catholic community is just coming back to, it's a big question, but it's a simple question, I would say, which is, what would Jesus do?
Mm,
um, my hope comes from seeing some faith leaders, and actually hearing your podcast it just filled my heart and my soul, because you are taking up, in whatever way, the charge to remind people that the teachings in the Bible about love and acceptance of
mm,
everyone.
mm,
So that's where I start. Now, there have been moments where I have had, after a talk, someone come up to me and say something incredibly offensive,
mm,
and racist. And there are moments where I need to choose to just, from my own protection, like, walk away, or times where I do engage in a conversation. And where I start is just from someone else's humanity, right? And
yeah,
just understanding, well, what is their lived experience around what they're saying.
yeah,
And the the impact that that has had, when you can just sit and just listen, even though you may fully disagree. What often happens is that you realize that both of you are actually wanting the same thing.
mm,
And the dangerous part about where we are now today is that there is so much misinformation, and it's being targeted to Black and Brown communities.
mm,
There's so much information to people that are struggling about, and I'm not going to get into this, but about who Democrats are, who's this, who's that, what side is, you're a socialist, like all that stuff is, to me, distraction. It's distraction from the real issues that we have to be addressing. And yes, quite frankly, part of what we have to be addressing are these dangerous narratives. So I feel like right now my job in supporting groups on the ground is that they get to lead in ways to remind us that we all belong, that we all should be seen and heard, and that we're all worthy of love and dignity
mm,
and equal humanity.
yeah,
And it's hard. And this is why part of the actual couple reports, and one of the most recent reports that we just released last week, or a couple weeks ago, is this idea that narrative change is a 1 year grant, right? It's a 1 year
mm,
project.
yeah,
Like, narrative change is deeply embedded. When you get into these narratives, right, these types of stereotypes, when you get into those, they're deeply entrenched. And they're also what people don't recognize the power that they have, right? And how they move public and political will. And
Yeah.
so for us, again, it is this idea that if we want to change systems, we have to change perception. And if we want to change perception, we have to change narratives about who
Mm,
and who we are.
that's good. That's good. What are kind of off the top of your head? I mean, I gave you a little bit of prep time, but what's one or two things that come to mind that you've seen change from the work you've done in the last 16 to 18 years since you've been doing this?
Yeah, I the one of the biggest change has been how we show up. And what I mean by we is how those that are funders or in the philanthropic space, how we show up with community and for community. And so much of, and even in our own history, right, we started as a collaborative that the agenda was set by the leaders of the partnership. Those are funders.
Mm-hmm.
And we were very effective and successful. And these times um, are calling on us to change our ways. The ways that we have been operating don't work, have not been working.
Yeah.
And that means that we have got to give up the driver's seat and allow communities who have long been living through these inequities, through these struggles and systemic barriers, through racism, that they be the ones that get in the driver's seat to lead in the solutions and to be the decision makers. So when we're seeing right now this big push and pull of forces, the hope is that we are seeing younger people coming out to saying, we are you. I come from this neighborhood and this is what I know is to be true and what
Yeah.
we know can be fixed. And this is how.
Yeah.
So I'm not taking a leadership role. I'm uh, honored enough to be able to speak on behalf of Convergence, and I'm sort of taking now the role of there are others to take up the mantle and the mic, not me.
That's good. That's good. Um, what would you say to people, or what do you say to people if you come across this regularly or not, that are skeptical about there being actual egregious racial disparity in healthcare? Because, like I said towards the beginning, let's just all assume everyone agrees that healthcare could be better and that we collectively desire for it to be better. But
Mhm,
then oftentimes when the racial disparity piece is brought up, you can lose half your group. So
mhm.
what do you say to that group of people? And I'm not asking that because it's fun to always pick on the racial element of it. I think that's just, I mean, you know this, Amanda, but the natural thing that we always come across. And I think it's just, I've been burned too many times when that thing's brought up that it's like, okay, whoa, let's keep that out of it. And I think it's just, it's a necessary thing to keep your foot on the gas on, because I believe that it's a huge element to injustice. And so I'd wonder how you would address that to people that are skeptical of the actual racial disparity and not just, hey, healthcare needs to be better.
Yeah. It's a good question. And I would start by saying that right now, people in power are making decisions where nobody is moving up and
Yeah.
nobody is doing better. So we are all suffering and struggling in some way, some way more than others, and some way longer than others.
Mm-hmm.
So there is a deep economic issue that we have to address. And those economic disparities are further exacerbated by racism, structural and institutional racism. And I would say this from my personal, this is not speaking on behalf of Convergence. When this country was founded, our founders used five simple words: liberty and justice for all.
Mm.
We are so far from that.
Hmm.
We've been, trying and working hard, and we have gotten closer. And now we're retreating. But if that is ultimately the vision for this country, then that means that we must look at all of the ways that people can't be healthy, that people are not benefiting or having opportunity to thrive and flourish.
Yeah.
So, whether that is, again, a job with a living wage, having health insurance, having even not just being dependent on cars, but being able to use buses and subways and bikes to
Yeah.
get to work. So, the disparities in healthcare, I would broaden to say they're disparities in health outcomes and the conditions that create health.
Mm.
So we have got to be a little bit more nuanced. And this is also sort of fighting the times. Things are becoming very sort of flattened and simple. And it is our job to begin to not to yes, be clear about what we're seeing, but to also be nuanced in saying this is how people are struggling differently. And therefore, we need to be really thinking about solutions that will benefit different people, but also benefit the whole collectively. And that is absolutely possible. When you take the movement of the disability movement that was pushing for, say, curb cuts, the where on your street corners when you see the little ramp,
Hmm.
that was used and that was advocated for very specific reason. But who else uses those? Mothers with strollers,
Hmm.
UPS driver that has loads of packages.
Yeah.
It's benefiting everyone. So we can think about targeted solutions that have multiple benefits for multiple people.
Gotcha. Gotcha. Yeah. I mean, what? How do you advocate to, like, what are the first couple steps when you let's say you've won people over who hold the power to change something, on the notion that a group of black and brown kids or families in a particular area, they're poor health care, and then you've linked it to um, being 30 miles away from any kind of grocery store slash none of them can are able to work above minimum wage jobs or don't have access to a car. How do you, like, what are your initial steps in attacking that systemic issue or those multiple systemic issues,
Mhm.
to and maybe explain it to uh, an average person's perspective? Because I think even if somebody that cares would hear that and be like, what am I going to do?
Mhm.
How am I going to fix minimum wage and the transit system, and how am I going to, erect a grocery store closer to these people? Like, what can be done about that? Like, if you've actually convinced somebody that, oh, okay, I see how the quality of these people's lives is not just about going to doctor's appointments, but it's all these different factors. Because to be fair, like, I think a lot of people would hear this, like, this litany of issues and think, what am I going to do about this?
Right.
Yeah.
Right. Well, honestly, there are days I'm like, it's overwhelming. It really
Mm.
is. So like
Yeah.
I wake up thinking, oh my gosh, what am I going to do?
Hmm.
But I would just say to at least start with look beyond individual stories and
Mm.
start looking at patterns, right? Just start looking at patterns. When black women with graduate degrees face higher maternal mortality rates than white women with a high school diploma, that's not
Mm.
black women failing to care for their health while they're pregnant.
That's
It's
good.
evidence of systemic failure.
Mm.
And so skepticism comes from narratives that minimize or deny racism's impact. But those health outcomes don't lie. These disparities are measurable, they've been documented, and they've been persistent over time.
Yeah.
So there's bigger conversation I know right now around data and truth
Yeah.
and intentional misinformation. So
Hmm.
we've got to be actively, proactively shifting the narrative so that the public understands why these disparities exist and what can be done about them, and
Yeah.
who the people are and organizations to support alongside us.
Yeah.
Um, for anyone that's even just interested in thinking about narratives or stories, I one of the most powerful talks I've ever heard was when the Nigerian novelist Chimamanda Adichie's TED Talk in 2009 was titled "The Danger of a Single Story." It was a
Mm,
powerful and beautiful talk where she talked about her own personal journey when she heard about a single story. And she actually started the talk by saying she heard a single story about Mexican people. And that was all that shaped her belief about what Mexican people are and are not. And what she warns us about in her talk is that when we stick to a single story about a person or a country, we risk a critical misunderstanding of people
mm,
that can lead to fear and resentment and violence that we've seen.
yeah.
So where we can even start with a conversation with someone that you've never spoken to.
Yeah.
On as much as I can, I try to I work at home, but I go out and I talk to, the local bodega owner. I talk to the cab driver. I talk to the teacher who is teaching my 4-year-old nephew.
Yeah.
So there are ways where you begin to understand what others' experiences are. And that then helps to inform and shape, like, wow, I thought X, but really what I'm hearing is Y. It's
Hmm.
not the truth in what I'm hearing from people.
Yeah.
And so we've got to break out of this isolation that we've been in and start connecting with people again.
Yeah. Remind me where you're located right now?
I'm in Brooklyn,
Okay,
New York.
Brooklyn. Is that home right now?
It's home. Yep, it's
Okay.
been home for about 14 years.
Okay. 14. So
Yeah.
is Brooklyn, how close is that to Vassar?
Oh, we're probably a 3-4 hour drive.
Okay. Gotcha. So
Yeah.
you didn't necessarily stay near your college or anything?
Yeah, I actually lived in different cities, which was also, again, very informative and to my journey. I've lived in Boston, Atlanta, Houston, Oakland,
Wow.
and now New York. Yeah.
Okay. How much how well traveled are you in the last like year or so between all those cities? I wonder what your
Um,
perspective is on things going on.
Yeah, good question. I have not traveled as much,
Okay.
even coming out of COVID, right? So travel for me was like 3-4 times a month
Sure.
to cities around the country, and now it's slowed down considerably. But still going back to Texas,
Okay. Yeah.
to El Paso, Dallas, seeing what's happening there. So there are even different places where I visit regionally just to get a sense of what's happening in different communities.
Yeah. What would you say, speaking of misinformation, give us some reality here, Amanda. What is your perspective and feeling um on the state of, I don't know, maybe not just politically, but the state of yeah, okay, politically, I guess. In New York, and I'm sure you have family still, but in Texas, maybe like in
Mhm.
Oakland and a Boston you mentioned, but like let's even just specifically talk about like the difference between how things are in Texas right now and like a Brooklyn, New York. Like what is your experience? Are you or people around you actually living in fear, walking around on the streets? I mean, I've friends in Chicago. They say it's as bad or worse than what I'm seeing, like on Instagram. And then other people live in certain cities. I've like a family member in LA that's, like, yeah, at times it's bad, but a lot of the stuff you'll see on social media, she says, is very zoomed in and like a lot of people outside, the frame are just living normal life. And so
Yeah.
what would you say, in your opinion, is going on with, I mean, the elephant in the room is immigration and ICE and that kind of stuff. Like, what's the state of people of color walking around these cities?
Yeah. Well, in my humble and one person speaking, there's a lot of fear.
Hmm.
There's a lot of fear, and I think we are all living um, with fear of this idea of the other person, of this the scary person that we don't quite put a face to.
Yeah.
Um, uh, and the reality is that, though, in places like Texas, or California. I mean, these are things that our communities have been attacked and targeted for decades.
Mm,
So it's nothing new.
okay.
It's nothing new. It's intensified, absolutely.
Yeah.
Um, but the other thing that's dangerous when we think about narratives, right? Like take LA. You were right. I was in LA a few months ago. And if I hadn't seen anything on the news or social media, I would not think anything is happening in LA.
Hmm.
Like, there are definitely areas of LA that are completely disconnected, right?
Yeah.
But the narrative that was being told by the administration is like, there are dangerous people in LA and we've got to come in and save the neighborhood and community, when that's the narrative that's being told, right? The othering of immigrants, they're
Yeah.
dangerous, we've got to come in and take them out. And the reality is, like, in a place like where I live in New York, um that is happening. And um there are people every day that are countering that narrative of people being dangerous, of people not contributing. So I think people are living in fear because they're getting a lot of misinformation. There are people that are intentionally stroking that fear and fueling that fear
Yeah.
for political reasons. And we have an uphill battle to take that down and to be able to rebuild what I said seems so far, which is that all of us live, um, with liberty and justice and dignity for all.
Yeah.
And I think that I'll just say this in my personal view. Um, America's, I will call them, kind of original sins
Hmm.
around genocide and slavery, oppression of various communities, we have never acknowledged it,
Hmm.
much less really repaired and healed from that.
Yeah.
And I truly believe that if we are to get to what the founders dreamed of for this country, that we must begin to acknowledge the violence, the transgressions, that the harm that has been caused. And it's not just one institution, one college or university, or one organization. It is everybody collectively saying, this is our history,
Yeah.
and we have to acknowledge it in order to repair and heal and move on.
Yeah. What are ways that we can do that?
Well, and one of the things that I was going to share, and I think one of the questions you had asked was like, well, what are the steps? What are the actions that need to be taken? And I would say that the solutions that communities know, um, are using to lead in creating the kinds of solutions that we need, is they're not just policy solutions. There are some places that we are supporting organizations where what they're doing may sound very simple or um, not impactful, and they've had a huge impact. So, one example is in a small town in Kansas, the organization that we've been supporting has created coloring books for children, and
Mm,
that show civil rights leaders,
mm. Yeah, I was gonna ask about
that
education.
show, yeah, historical leaders, right? So
Yeah,
it's education, but also there's an opportunity for children to draw community leaders, right? Like
yeah,
their grandfather, their mother, their friend. The idea that there are so many leaders and it's going to take all of us to get us to the right place,
yeah,
um, is so important. And really seeing ourselves that we are the leaders, and we are our ancestors' wildest dreams of making that dream come true.
yeah. No, that's good. I love again so much that it keeps being brought to simple things, narrative, and I love the example of kids. You know, I got 3 little kids. Just as simple as coloring and learning. Um, yeah, learning about accurate history, because I think I would kind of echo even what you're saying with as far as like education goes. It's not even my response, and it's admittedly a little bit cynical to the question I just asked is, can we just stop not working against this stuff? Like, it's not even that. I think the answer is, let's change all of, public school curriculum to be only about the civil rights and black and brown
Mm,
people. Not that that would be anything ridiculous, but I'm just saying, like, my answer isn't even extreme. The bar is, hey, can you just stop taking stuff out and avoiding teaching the minimum things that you were already teaching in the first place? Like, that would be great. Like, that'd be a great
right.
start. And I think people are I think it's being framed in such a way that many people are viewing this omission of accurate history as a little too lightheartedly. Like, I'm not
Hmm.
talking about the people that are like pro doing it and whitewashing everything. Like, that's another animal that I just hard to even talk
Hmm.
about, because I think that's crazy. But I think enough people agree that something like that is crazy, but are like, what can you do? Or it's not, the worst thing. And I think people like you and me are like, no, 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 it is the worst thing because it leads to the worst thing. Like, to not be educated about this stuff uh, is a travesty. And
Yes.
I think these are things, because they have to do with, you know, kids' education doesn't get such a rise in certain contexts as, a health crisis.
Mhm.
But I do, I think it's very helpful to see how you've linked the two, and that it's all, it's a, machine. It just keeps a hamster wheel, keeps going round and round. And I think, it's the only people that are benefiting are the people at the top, really. Um,
Yep.
yeah, I think
You
it's
know, and,
helpful.
and there's a
Go ahead.
reason. There's a reason. I mean, there are people in power that, and as I said, we have not dealt with um, our sins, the harms that we've created. But also, there are people in power that want to keep their power,
Right.
and so they are intentionally doing all of this to be able to keep that power.
Hmm.
But in the example that I gave around the coloring books, again, it has opened up, not just kids' minds and thoughts about what is leadership, right? But it's also started conversations in communities across political and
Mm,
racial divide
yeah.
to begin to understand each other and to begin to heal. And none of this is fast. And I will say this again: none of this is a 2-year grant. This is long term work, and this requires, and you said it perfectly, David, this requires us to not um, reduce our foot on the pedal. We have got to keep accelerating and pushing in ways that the other side has been pushing all these harms.
Hmm.
But the idea that, you know um, well, this, a certain nonprofit didn't reach the kinds of measures that we had already predetermined, all that stuff is getting in the way of the real
Yeah.
work. And when you see something like, the what the right has done so well is they fund and invest in their narratives and their ideas and agenda,
Mm,
whether you fail or flail. They will keep investing
yeah.
because their eyes is on the prize. We have to keep the eyes on the prize and begin to shift people's ideas of these are not the solutions that are going to benefit all of us,
Yeah.
and moving in that direction.
Yeah. That's great. I mean, we've touched on this a little bit, but as we wrap up, what is something that you're excited about right now, looking forward, like maybe in this next year that you feel like some real progress has been made and you can see some tangible, like this is making a big difference, or this is by this time next year, I'm excited to see these results. Anything come to mind?
Yeah, what keeps us going is, as I said, the power of collective leadership. And we are using our funding and supporting community organizations that are doing things in unconventional ways, that are creating unlikely alliances,
Mm,
that are going about coalition building in ways that we've never seen before. And we saw it here in New York, we've seen it across the country. People are organizing. They want better. They're mobilizing because, like, none of this is working for anyone. So that kind of coalition building is so exciting to see. It's exciting to see younger generations taking on deep topics that nobody has wanted to touch for a very long time. They are bold, they're fearless,
mm,
and that's what we all need. We need to be bold and we need to be fearless. And the last thing I'll say is what the most tangible difference has been is as we focus on the narrative power, the power of the story and the storyteller to changing policy, is that once communities can reclaim or claim that narrative and they reclaim their power
mm.
and the systems begin to shift, that is how we're going to move things.
Yeah, that's good. Do you have any a couple organizations you'd want to shout out?
I mean, I would love to shout out all of our grantee partners, and I would say just shout out to the incredible work in Kansas and Missouri, in Buffalo and California, and Louisiana. We have supported these brilliant leaders that are taking on the biggest issues of our lifetime.
Mm,
Um, and they're all doing it with deep care and love. And so I come back to um, the teachings of the Bible and where I started, which
mm,
is they are the manifestation of what I was taught we should be,
mm.
how we should be showing up in this world.
Yeah, that's
So
good.
I honor all of them.
That's good. Very powerful. Amanda, thank you so much. This was excellent. Learned so much. I know our listeners did as well. Listeners, man, if you, I feel like Amanda, correct me if I'm wrong, but I want them just to take away the connection of narrative to making these changes. That's such a refreshing thing to hear. As admittedly, I can focus on policy too often, and it's so much more simpler than that sometimes. I think we can discount how powerful storytelling is. Yeah.
Yeah, absolutely. And the more that we can take the time, you sharing your story, me sharing my story, us being able to connect and understand each other in the ways that we're different in the same, it sounds so, I don't know, simple or maybe even naive to some people, but
Mm,
that is where we've got to start again.
yeah.
Um, and come back to our collective humanity.
Yeah. Amanda, thank you so much. I'm going to use your words and say this cannot be the last time we do this. So I appreciate you coming on and looking forward to you coming back at some point, maybe multiple points.
Yeah, I'd
Yeah.
love that.
Yeah. Thank you so much for coming on here. Listeners, thank you so much as always for listening. The music you're listening to is done by our guy Dylan Denton. Our artwork was created by Ashley Bush. And we'll see you guys next time. Bye.
Bye.
three dimensions got me bent and got me twisted. I know I done said a lot, but I should probably stop pretending. I don't really hold the key and I can't really push a button. I just step up to the mic and try my very best to bust it, but I ran out of breath. It's tight in my chest, my feet just might fail. I can't stand the breath. The nightmare might scare you, no worse than reality. They hunt you by day, R.I.P. I'm a robbery. Everybody got a time, but that's less than comforting. I hope I'm alive by the time they choose to comfort me. Mosquitoes in the vein, or leeches on my soul. This money on my mind is a fracture in my bones. You get crippled by continuing existence like a ghost. And they wonder why we drink, and they wonder why we smoke, and they wonder why we think that everything's a joke. I'm shocked that we can sleep, must be the thought of letting go.